A global leader in digital gender-affirming healthcare has officially launched in the United States. I'd argue it comes with some controversy. GenderGP.com is offering evidence-based and affordable access to care for transgender and non-binary individuals across certain states in the US.
We're going to talk about the GenderGP.
Okay.
So the GenderGP is this British chick called Helen Webberley, right?
Oh, I saw an interview on this.
Yeah.
Some English guy was interviewing her.
Yeah, well, this might be the one.
Right, I just saw a little bit of it, but he made her look like a nutbag.
Yeah, I think Andrew Gold interviewed her as well and made her look crazy.
Okay.
But just on that intro we just saw, right? So the GenderGP is launching in America. And the reason we're doing this video, this isn't going to be like a ha-ha funny video. This is like actually really concerning. And I think Helen Webberley is going to come up more and more. But what is gender-affirming care for non-binary people?
I was just thinking that. Why do non-binaries need special health care?
Yeah, like what does that even mean? Are you going to take hormones for some reason? Like for what? What are you transitioning into? I don't get it.
They just start disappearing into nothingness.
Yeah. So anyway, this is Dr. Helen Webberley.
Dr. Nutbag.
Yeah, she looks kind of evil. We've mentioned her in passing on this channel before. I think earlier this month we highlighted one of her tweets. She was talking about Laurel Hubbard.
Yes, I'm a weightlifter.
Yeah, the weightlifter from New Zealand, the transgender weightlifter.
Oh, just on that note, did you hear that New Zealand have banned puberty blockers?
Is that right? Well,
They
Helen
have.
Webberley is not going to be happy. But anyway, Dr. Helen Webberley said they weren't fucking born male. They are female and always have been, and now are being excluded because their birth certificate was written wrongly. And they have so many sodding hoops to jump through to correct it. There.
I have seen that tweet before.
Yeah,
She's
yeah.
nuts.
Yeah, we've covered it. So Helen Webberley runs the Gender Clinic, right? Be seen, skip the NHS's 5 to 10 year wait time, get compassionate, personalised, gender-affirming medication in just 2 to 3 weeks.
Jesus.
I mean, maybe there should be like a wait time, just saying. A little bit of room to breathe. Anyway, let's have a look. Let's go!
Joining me now is Dr. Helen Webberley, the founder of GenderGP.com. Helen, thank you for your company. Welcome along.
Thank you very much.
Just to clarify, just tell us what GenderGP.com does. You basically provide referrals for prescriptions from doctors for people who want to access puberty blockers, cross-hormone drugs, and so on.
Yeah, so basically, in a nutshell, gender-affirming care means switching off your own hormone production from your ovaries or testicles and then swapping it with the opposite hormone. So basically, that's how it works.
Now, I put it to you that this bird is fucking evil. And this guy, this British guy, absolutely, in my opinion, destroys her. So he starts off with like a rapid fire, these are your controversies. This is what you've been in trouble for. And it's quite a big list.
Yeah, and I've heard her say before that she feels it's discrimination to say that trans people should question their mental health before doing this.
Yeah, which is ridiculous.
She's dangerous.
Yeah.
In February 24, Dr. Helen, the Telegraph reported that the Clinical Commissioning Group for a South East London clinic had issued a safety alert for GenderGP.com, saying that, advising doctors not to prescribe puberty blockers or gender-affirming hormone therapy on your company's advice because your clinic doesn't provide physiological or psychological support to its patients.
So there was an alert put out about GenderGP.
Mm-hmm.
Now she goes on to explain that this was actually withdrawn after a bit of toing and froing, but he keeps going on with this rapid fire.
You were also involved, this is pertinent to our discussion, so I'm just going to reel through these. You also, in 2024, the High Court ruled,
That's it, yeah.
yeah, a 15-year-old child was prescribed dangerous levels of hormones by your unregulated online clinic
Wait.
without speaking to a doctor.
Where are you getting that one from?
Court transcripts from the High Court.
Which High Court?
In London.
No.
The teenager known as Jay was born female but identifies as a boy and has autism.
That's not UK news. There was an Australian case.
Oh, owned! It wasn't actually in the UK, it was in Australia.
But
Oh,
it still existed.
fucking hell, what a cope. So there was this 15-year-old, was it a boy, who is autistic. It seems to be the case that many kids who are like transitioning or want to transition are autistic. I think there's quite a link there.
Yeah, it's a red flag. I mean, autistic kids already feel like they're out of their bodies a little bit, like they're
Yeah.
not normal. So planting ideas like that in their head, it's not good. good.
Yeah, so this 15-year-old has been palmed with like a drastic amount of cross-sex hormones. Like, what is a 15-year-old doing taking cross-sex hormones? Isn't that, I mean, that should be illegal, shouldn't it?
Absolutely.
Anyway, he keeps going.
Judge Sir Andrew McFarlane said there must be a very significant concern about the prospect of a young person such as Jay accessing cross-hormone treatment from any offshore, online, unregulated private clinic. The judgment in your case, Dr. Helen, says there was no medical examination, blood testing, or other clinical evaluation was undertaken. Jay has not had any direct communication with a doctor at any stage during the referral to GenderGP.
There was no consultation with a doctor. There was no psychological evaluation. There was no blood tests. There was nothing.
That's crazy.
Yeah. Now, Helen Webberley just doesn't answer this, and the guy keeps going. Like I said, it's fucking rapid fire. I just want this to be like an orientation for us, if you will, on Helen Webberley, because like I said, I think she's going to come up more and more.
Right, so he's like, bet you're not going to worm your way out of this one. You will answer the question.
Yeah. Now her husband, who is also apparently, or was also apparently a doctor, comes up. And Helen does not look very comfortable.
Your husband, Mike Webberley, is he involved in GenderGP? No. He's on your website.
He may be from old, but he's not involved.
Why was he struck off?
There were many different reasons in that court case against my husband, but he's not here. I think if you want to ask him, you would ask.
Well, the Telegraph reported a reckless doctor, referring to your husband, who wrongly prescribed puberty blockers to a transgender 9-year-old child after a 10-minute chat on Skype, has been struck off. Michael Webberley's treatment of 24 patients was deemed a catalogue of failings between February 2017 and June 2019. That's what the tribunal found.
Well, this is what the Telegraph is reporting, yeah.
Directly from the tribunal.
Wow.
Directly from the tribunal. So her husband, who was at the time of this interview on her website, I can't find him now. I think he's been taken off because of this. But he was prescribing cross-sex puberty blockers to a 9-year-old after a 10-minute Skype chat.
That is so fucked up.
I know. So anyway, now they get into the nuts and bolts. He's done his rapid fire, like, this is why you're fucked. This is why you should not be trusted. But now he sort of gets into, like, what do you believe kind of thing.
This is fucking crazy. It's altering your body. It's like, would you make a 10-minute decision to chop your arm off?
No.
No. Would you want a second opinion?
Yes, and I would argue that if you wanted to chop your arm off, unless it's, like, infected and can't be saved, then you have some sort of mental illness.
Yeah, it's crazy.
My 2-year-old son came up to me the other day. I went back home to the UK, and he said, "Daddy, I'm going to have a baby." And I said, "Zach, you can't have a baby because you're a boy. You're a man. You can't have babies." And he said, "Well, I'm going to be a girl. I want to be a girl." What would you have said to him if you were me?
Well, I wouldn't have said, Zach, you're a boy and boys can't have babies, because that's absolutely not true.
You gotta be some type of retarded.
What? I mean, when I first saw this, I thought, is she like referring to like men having babies as in like impregnating a woman?
Using sperm.
But no, she's not. She's actually this fucking crazy. And these people just like twist fucking terms kind of thing.
I hate this social construct bullshit.
Yeah.
Like, everyone knows that a man is a male and a woman is a female.
Yeah, but the other thing is they're like sneaky with these terms sort of thing. Like they'll argue that gender has nothing to do with sex. But if you want to change your gender for some reason, you've got to take these drugs that alter your sexual biology sort of thing. Why would you need to change your sexual biology and your sexual reproduction junk for a state of mind, for a social construct?
Yeah, that's right.
Sorry, you think males can have babies?
Yes.
Right.
Do you want me to explain?
Yeah, please.
Now, he was very specific with his wording there. He said, you think males can have babies, right? Not men can have babies.
Yeah.
Because under her rules, a man can have a vagina, blah, blah, blah. You know the story.
So transgender males have a womb, a uterus, and ovaries.
But a transgender male is a female.
Yeah.
Like, there's no ifs or fucking buts about it. A transgender male is a female. I mean, male and female are inmalleable. It's your biological sex. You can't fucking change that.
I just can't believe she's saying male, transgender male.
Well, a transgender male, if we're going to use that terminology, a transgender male to me would be a dude who has like a dress on, who dresses up like a chick. Because like I said, biological sex, not malleable. It's not changeable. interchangeable. So a transgender male is a dude who dresses up as a chick, surely.
Yeah.
But she's using it as in like a transgender male is a female actually who
Yes.
dresses up as a dude.
A female who is now a male.
Yeah, which can't happen.
Fucking doctor.
I mean, if you're to insert yourself into her worldview, then a woman can become a man, you know, because we're talking about genders. But yeah, you can't become a male or a female. You are a male or a female, obviously.
Okay, so they were born, if you like, female, and but they actually identify as males, so we refer to them as males. They have ovaries, a womb, a uterus, a vagina, and that means you can carry
Transgender males being women.
Well, that's extremely disrespectful to transgender males. I don't.
Well, they are women, aren't they? They're biological women.
They are males.
Listen, they are males, and if you say otherwise, you're hurting their feelings.
I mean, we have to look back at that tweet, don't we? Where she was getting so pissed off. She said, it's not their fault that they were assigned the wrong gender at birth.
Yeah, again, blurring the lines between sex and gender. I'm so fucking over it. I feel like it's kind of on purpose these days. Like on one hand, they say, oh, gender, sex, completely different things, but then they interchange these fucking terms. And everyone does because the terms are actually interchangeable. Gender, as far as I know, just became a fucking word a while ago because people were uncomfortable saying sex.
You know what someone should do as a social experiment? Someone should go to this broad and be like, okay, as a woman, I feel like a man. What can you do for me? And then 2 weeks later, walk back into the same room and say, no, actually, I feel like a woman.
Yeah, how often can you fucking yo-yo with this chick? Yeah. You know what the scary thing is? On this GenderGP fucking website, I haven't looked at it properly yet, but I'm sure I will at some stage. There's an AI companion bot that you can use to discuss your transition and how you feel. So it would be interesting to sort of go on it and say, hey, I'm fucking 12 or 13. My mummy thinks I'm a boy, but I feel like a girl. What should I do? It would be interesting to see what advice it gives you.
So fucked up.
Yeah.
Let's talk about puberty blockers. Lupron. How active is Lupron prescribed to people, to children? By the way, how young are some of your referrals?
So Lupron is the go-to puberty blocker drug, right? Now Lupron is also used to castrate pedophiles.
Jesus.
To chemically castrate pedophiles.
Oh, chemical castration, yeah.
Yeah, so it like removes sex drive and shit. So like it's a really fucked up drug. So he just asked her, what age would you prescribe Lupron to your patients?
Well,
9-year-olds?
it depends when puberty starts. It's not an age thing. Whenever your ovaries and testicles wake up,
Which could be as young as 9.
it could be as young as 8 if you like, yeah.
So you're happy prescribing 9-year-old children with
The alternative.
puberty blockers,
Yeah.
cross hormone.
If that's puberty blockers are the best time for puberty blockers is when puberty starts.
I mean, I don't know what to say. It's pure evil.
I'm just sitting here. I feel like someone's just slapped me across the face.
Yeah. Aren't puberty blockers, didn't they make them illegal in the UK as well?
I'm not sure.
I thought that happened. I thought I saw that. I think there's like a few fringe cases where it's like clinical trials and that sort of stuff where they're still using it. But I think by and large, puberty blockers in the UK have been banned. I could be wrong. I'll see what I can find.
Yeah, sadly, I think it's going to take a change of government here before we can see something like that.
The Tavistock Clinic found that up to 50% of patients were on the autism spectrum.
This one actually fucking makes me angry because like I sort of hinted at before, there's a big proportion of these kids that like want to transition, that express interest in transitioning, that are on the autism spectrum. And it's kind of like, well, how much pushback are they getting? How much psychological evaluation are they getting? I mean, it should never fucking happen with any kid. But like the fact that there's a high proportion of autistic kids sort of sends up alarm bells to me.
Yeah, a high proportion of autistic kids with very liberal parents.
Yeah, and like you said before, autistic people, and we know an autistic person, we're close with an autistic person, they seem to be very, I don't want to say not comfortable in their own skin, but they're always looking for some sort of relief, it seems to me, whether that be like stimming or like, you know, that sort of thing.
Sensory relief.
Sensory relief, yeah. Now, could this whole gender bullshit sort of play into that? Could they get this idea into their head that if I only changed gender, then I would be more comfortable in my life.
Yeah, I feel like autistic kids, they already feel that they're kind of out of place in their own bodies. They don't fit into this mold of society. And when you add puberty, you know, going through the whole phase of being a teenager.
Yeah, where you feel awkward as fuck anyway.
Exactly. For anyone, it's going to be exacerbated even more.
Yeah, I agree.
Suffering with depression, maybe suffering with autism, Asperger's, and so on. 50%. Do you not has it ever sort of dawned on you, or maybe in a conscious moment you've thought, well, hang on a minute, maybe these children who are saying they're born in the wrong body, you know, one day, as I refer to my son, says that he's a girl. Has it ever dawned on you that maybe they're just unhappy because they're struggling to deal with everyday social cohesion and because of their autism
Well, I don't think that's ever dawned on me. Of course it's dawned on me. I'm a doctor. But are you saying that people with autism or depression shouldn't have care? Is that what you're kind of saying?
I don't think it's...
My goodness, if you're autistic, then you mustn't have care?
No, Helen, for fuck's sake. What he's getting at is it's very alarming that 50% of these patients, in quotation marks, are autistic. Now, in Australia, I think the latest consensus is it's about 1 in 40 kids are autistic. Now, if only 1 in 40 kids are autistic, and I shouldn't say only because that's a staggering fucking number, but if 1 in 40 kids are autistic, yet 50% of these patients fronting up to these fucking gender clinics are autistic, then that should send off alarm bells.
Yeah, he's not saying that autistic children shouldn't get medical care. He's saying they shouldn't get medical care from you.
Yeah, so we've rapid fired through the fucking controversies and the legal stuff. He's sort of been teasing some of her fucking crazy ideas out of her brain, and now he wraps it up with exactly what he thinks of her. This is scathing.
I actually think you're very dangerous. I think you're taking God-given children who are innocent, who should be left to enjoy the fruits of life and the wonder and amazement of life, and people like you and your husband who has been struck off for recklessly pumping children, or at least referring children for hormones, dangerous levels of testosterone, which they shouldn't have been given in the first place without proper medical diagnoses or review in the first place. I think you're very dangerous, and actually I'd say borderline evil.
Yeah, I agree. Well said.
She didn't like that.
No, she didn't. So that is Dr. Helen Webberley, the Gender GP. Now in America, previously in Australia, to my fucking horror. Look her up. I think we're going to see her on the news more and more because she is fucked.
I agree.
Visit Sugar Tits. She has a channel.
Yes, I do.
And we'll catch you later. Thanks for watching. Ta-ta. Bye-bye.
See ya.
Recession, give me better times, Recession.